Okay, so for the hip side of things here, we've already got our 2 needles up at L5 and S1, S1, S2. Now we want to look to some L5, S1 musculature to pair that with more peripherally. Again, a lot of these people, they'll come into your clinic, they've got the trigger points through here, and they like for you to dig around on here, which is fine, you can do that. They say, can you just dig into my just put your elbow in my piriformis, and so this is sort of an alternate to that, and I certainly feel like it's more effective than just. Now, there's not to say that I don't dig on people at times when they want that, but I feel like this is the more bang for your buck. I think this model probably overstates how big the glute medius is, or excuse me, glute minimus is on the pelvis here. I think it's probably a little bit more narrow than this. So really, in the end, you want to, so this is glute med, which is kind of retracted here, cut back. This is glute min. If I am needling this person, I'm going to, again, be on the opposite side, and I'm dropping over this way and coming at kind of a lateral angle in. You can't be too high because then I'm going to get more tendon. I need to get the fleshy, the contractile part of the tissue. So I'm going to go this way to get both glute med, and it'll go through glute min. And I'm going to go all the way down into the muscle tissue until I touch bone again. Once I get to bone, I know I've got both glute medius and glute minimus. Okay, so I've got a needle here. Whoop, there goes my pelvis. So I've got a needle here. I've got one up S1 or S1, S2, and L5. The last one that we put in would be your piriformis. Here's our piriformis here. So you imagine your sacrum somewhere in the range of S2 to S4 or maybe 5-ish there, and it runs laterally here. As you can see, again, if I get too far out towards the greater trochanter, we're going to get in tendon. But I need something that contracts, so I'm going to be a little bit more medial. Again, if I go too far medial, and this is getting really far medial, then I'm just in no man's land there, and you don't want to be going through this, dropping into an empty space there. We want a bony backdrop. If you get a tacky backdrop, you're probably on the capsule there. That's fine. You're safe there. But essentially, we're going to locate our bony landmarks to figure out where your piriformis is, and you're going to drop, it's usually a very long needle, you're going to drop that thing straight down right on top of the piriformis. So then you end up with your circuit of piriformis, glute medius and minimus, S1, L5. And then we'll show you how to, I'll walk through the electrical stimulation with you on that as well. All right?